Solving the next Cold War. I'm Dennis Berman of the Wall Street Journal with Mary Tolan, the CEO of Accretive Health. Mary, thanks for joining us here in Davos.
My pleasure, Dennis.
You mentioned earlier solving the Cold War, perhaps the medical costs are our generation's Cold War. What do you mean by that?
Well, I think that if the previous generation really had to solve the Cold War of the same level of consequence, is this opportunity for our generation now to really crack the code on improving quality and reducing costs in healthcare.
Right. Now, Accretive Health works with hospitals, healthcare providers, helps them manage their bills, helps them get some better results from how physicians operate. Tell us a little bit more about what Accretive does.
We do. We have two value propositions. One, we partner with physicians and hospitals to take on accountability for managing populations and really improve the triple aim, which is improving quality, improving the affordability of care, and improving the patient experience.
Right.
And this is a really new thing, and it really stems from the philosophy of what's in the Accountable Care Act. The second big value proposition that we have is helping hospitals and physicians reduce the administrative costs of care.
Right.
Because if we could spend a lot less on that and move more of it into actually direct patient care, that's better.
Right. Now you and I are in somewhat disagreement about whether we can actually accomplish this goal. This has been a stated goal for 25 years, and each step of the way, each year we see healthcare costs rise, certainly far above the level of inflation. So what is different now, 2013, than was different for the decades past?
The promising thing that's really happening right now, Dennis, is that incentives are shifting. And for the first time, we're really giving providers now accountability and incentives for managing patient care in its entirety, and moving away from per click or volume-based reimbursement to value-based reimbursement. And once I change incentives, we have the beginning of new possibilities.
Now, you said earlier that you thought that hospitals and doctors were relatively receptive to this idea. When it comes down to it, when you go into and you talk to a doctor and they say, well, you know, I think my standard of living is going to be reduced because of this. Like, what's the pitch to those guys who are going to, frankly, be making less money potentially than they were before?
Actually, this is the kind of change that can be very good for physicians too. In the sort of per-click world, reimbursement looks like it's just going to keep going down, which means spending less time with each patient. That's how you address it.
Right.
That's a bad thing, because if I don't spend enough time with patients, I can't really give them the kind of care. So in the new world now, with accountable care and with the new types of value-based incentives, I'm going to really have the time to spend with the sickest patients.
Right.
And that's going to change everything. And if I can actually succeed at that, I don't have to be sort of this person who sees their reimbursement going down, but I can actually have a livable compensation and be achieving the triple aim.
Right. Okay. Now we are in the realm of buzzwords here. It happens to be mountains, but the buzzword, of course, is big data and analytics driving people's decisions. You mentioned something really interesting about flagging the patients who might be the sickest or produce the most cost for a physician's practice. Just tell us real briefly how data is driving those sorts of flags.
Well, it's really about trying to figure out, if you're a physician and you might see 2,000 patients during the course of a year, trying to understand which of those patients need a lot more of your time and care and attention. And we now have algorithms that can begin to help us understand who those patients are. It might be 5%. So 100 patients that I've got to give a lot more time to, which means instead of getting a 15-minute appointment, I might need to give them an hour-long appointment, because I really have to figure out who the 3 specialists are that they're seeing and really understand the 20 medications that they're on. And so that's where big data can really help. The other thing that big data can do is, once I'm trying to figure out what I'm going to do with a particularly complex case, it can give me all the information on what's been proven to have the best outcomes.
Right.
What is really going to give me the best efficacy at the most affordable cost. And that's really good information too.
Mary Tolan, Accretive Health, thanks for joining us.
Thank you.